Hello and welcome to a time special presentation where we explore real-world lessons from the classic Tamil text Thirukkural with motivational speaker, author and diversity champion Bharathi Baskar as she explores the masterpiece. In this day and age, it's not very often that one finds a doctor who makes a diagnosis without administering a single test. But that was how family doctors from decades would do it. The nail polish smell on patients, for example, opening up clues on possible diabetic ketosis. Family medicine was all about comprehensive care, relying almost entirely on the doctor's skill. And that is what we explore in the Kural Thiruvalluvar's take on doctors.
My mother believed that only Dr. Devasigamani could treat all our ailments. Whenever we fell sick, our journey from home started in a yellow cycle rickshaw and culminated at Bazaar Road, Mylapore, near the doctor's clinic. The clinic could seat about 20 patients, but close to 100 used to row up in the crowded lane. Some would keep stones to represent them in the waiting line. Once I witnessed a woman in the queue with nothing to leave behind to stand for her. She removed her hair attachment and left it to wait on her behalf. When we finally met the doctor, he always examined our eyes with a torchlight for an extended period before prescribing any medicines. It was as though he was peeping into the person's body through the window of the eyes to check what was wrong. I don't recall him prescribing any tests except for a few occasions. Surprisingly, we always got better in a couple of days. Even today, as I pass by Bazaar Lane, Mylapore, I can't help but turn my head to spot the old clinic, which has become an apartment now. Doctors of yesteryears had the uncanny ability to diagnose like a detective, and that part of clinical medicine is slowly vanishing today. By looking into the eyes, touching the patient, smelling the patient, and using the doctor's knowledge of the family history of the patient, they diagnosed and used clinical tests only to confirm what they already knew. There is a story about a famous doctor who practiced at Chennai. A woman from a wealthy family came to meet him with a complaint of very frequent headaches. He looked at her for a long time and asked her a rather strange question. "Is your nose string a blue Jagger diamond?" The lady was both embarrassed and proud. "It's a gift from my husband," said the woman. "Remove your nose ring and check if your headache recurs," said the doctor. No tests, no MRIs, no scans. The diagnosis was quick and accurate. The lady had headaches thanks to the sheen of the priceless diamond in her nose. I met an entire fraternity of doctors who were students of the legendary Professor Dr. K.V. Thiruvengadam. They gave me a detailed account of how he taught them to use their olfactory skills for diagnosis. The unmistakable nail polish smell on patients with diabetic ketosis. The scent of grape juice in the breath of children who were affected with a particular type of infection. A culture test will be taken later, but Dr. KV would ask his students to check for the smell of fresh baked bread on the patient to diagnose typhoid. There were some neurologists. They used to close their eyes and ask their patients to walk, to listen to the rhythm of their steps. That was enough for the doctors to identify if the patient had Parkinson's disease. A friend of mine, now living in Canada, had a strange problem. She is a woman in her 40s with perfect health. Their family migrated from Jaffna in Sri Lanka to Toronto in Canada 20 years back, and they are now leading a prosperous life. She suddenly started developing epileptic seizures. The doctors were unable to stop the convulsions. Finally, a neurologist who did not rush her into tests probed for months and months to find the reason for the attacks. He zeroed in on the problem when he saw two elements of correlation. Her seizure attacks always happened at nights, especially when she heard a dog bark. On further probing, he traced the root cause of the problem to a traumatic memory. Traumatic memories are always disorganized. Images and flashbacks were in a bizarre array in her mind. He spoke to her and finally found the reason. When she lived in Jaffna during the war, a dog barking at night was the first signal of any army truck moving into their village. Women had to flee to hide and escape. Years later, even when she had settled into a good life, there was no escape from a mosaic of a memory laden with grief. With the single-minded determination of the doctor, the cause was identified and necessary treatment for the trauma was administered. She is recovering slowly. I have always wondered about Thiruvalluvar's knowledge on a variety of fields, but nothing surprises me more than his knowledge about medicines and treatments. He declares to doctors of all ages and all countries to go into the root cause and then decide the treatment. Noi Naadi, Noi mudhal Naadi, Adhu Thanikkum Vaai Naadi, Vaaippach Cheyal. Disease, its cause, what may abate the ill. Let the doctor examine these, then use his skill.